Welcome back. Hope everybody enjoyed the lunch. A little danger of food coma here, but that's not going to happen now because we got some really good stuff coming up for you here. I will let you on a little secret, which is that because we're in Sacramento and the temperature's what it is, our two speakers just took off their ties. Now they look like they belong in California. So that's an upgrade for us. Really excited to welcome you back to this afternoon. We are going to hear from Secretary Becerra in just a minute here. This is a two-person interview. KQED's Political Breakdown show is recording this for KQED Political Breakdown. They'll have it posted later today. We're going to do exactly a half hour, so it's the right length of the show. And it is hosted by Scott Shafer. Many of you know Scott, know his voice, if not his face, the senior editor for politics and government at KQED, wonderful journalist, great partner of ours. And to introduce the secretary, I'm going to ask our board member, Efrain Escobedo, to come up. He is the CEO of the Center for Nonprofit Management in Los Angeles, good friend of ours, and knows a little something about the secretary, so I asked him to do the introduction. Efrain.
Thank you, Neil. Thank you. Thanks. Good afternoon. So excited and honored to be able to be a venue where we have such tremendous conversations. So hopefully you all have been enjoying the amazing ideas and conversations. It's my privilege to be able to make this introduction and privilege to be serving on the CalMatters board with a lot of amazing and brilliant people. They say leadership and effective leadership cuts across sectors, right, and influences across generations. I'm humbled to introduce our Secretary of Health and Human Services because he is an individual and a leader that has cut across all the sectors I've worked in and been a tremendous influence for me, from nonprofit to working in local government to philanthropy. He has been an influence and really impactful leader across those sectors. So I think we're very fortunate to have him leading such an important department. And so it's my honor to introduce, one, a hometown Sacramento kid, two, one of our former long-standing members of Congress who was an avid champion for California's communities, and our former state attorney general, and now Cabinet Secretary for Health and Human Services, Xavier Becerra. So let's welcome him.
All right. Well, Secretary Becerra, we have a lot of issues to cover, but before we get to issues, I want to maybe ask a style question, which is not about the ties. You spent a lot of time, you're from Sacramento, you worked in the legislature briefly as a lawmaker, of course you were AG, you were in Washington as a Congress member for 24-ish years, but you've never been an executive in DC. And I'm wondering, what's your take on the differences between state government here in Sacramento and Washington, D.C. in terms of the way things work, what doesn't work, et cetera?
You know, California is probably as close as you get to a nation that really could stand on its own. And so in that respect, what we do in Sacramento is tantamount to what many countries, actually, very few countries can do what the state of California does. We are the 5th largest economy in the world. So in our own right, we are as big as almost every other country, bigger than most every other country. So stuff matters here. The difference, I would say, is just the magnitude. When I ran the Attorney General's office, I thought it was pretty big. We had $1 billion budget for the Attorney General's office. That's the largest AG office except for the U.S. Attorney General office. $1 billion, 5,000 people, operation. I now have a department that has 90,000 people, and my budget is $1.8 trillion. So just magnitude is the scale of it. You don't realize or you forget how big the U.S. really is and how impactful it is around the world. And so we're big as a state. Nobody compares in the country, and certainly very few places in the world compared to California. But compared to the U.S., the U.S. is just tremendous.
When you were AG, of course, you were the boss, and you're still the boss, but talk about the decision-making process in D.C.
Once I had my budget from the legislature and the governor, I was the boss at the Attorney General's office. And so no one could tell me, no, you can't sue Donald Trump 122 times. I was able to do what I thought I needed to do to protect the state. I still get to do most everything I need to do at the Department of Health and Human Services, but I do have a boss.
Anybody we know?
Yeah. Fortunately, this boss has been very, very, very good to me, as they say, because he has given us license to take the Department of Health and Human Services to where it's never gone before. The fact that there are more Americans today who have health insurance coverage than ever in the history of the country, more than 300 million Americans. By the way, yeah, that's worth clapping for, yeah. Just because I know you're not as inside as I am, 46 million of those Americans have their insurance through Obamacare, that program that wasn't supposed to work. So in so many ways, we've done so many things. I suspect most of you got at least one vaccine, I hope, for COVID. Under President Biden's term, we have essentially put about 700 million shots in the arms of Americans. That's never been done before. But what's never been done before, on top of the 700 million shots, is not a one of you had to pay a single penny for that vaccine, which would have cost you tons of money to get it on your own. But the president was committed. Everyone should get it. Everyone should get it. Regardless of your income, regardless of your zip code, regardless of your status, President Biden made sure everyone could get it.
I want to come back to COVID and some of those health disparity issues in a minute, but you mentioned, of course, California is the biggest state. We have about 12% of the U.S. population. We also have about a third of the homeless population. We have the highest rate of homelessness per capita, although, and oddly, Vermont is number 2. But what has the federal government done? What are you doing? I'm surprised personally that HUD doesn't get criticized more. You don't run HUD, but because we always hear that cities can't solve this. The state is doing a lot, spending tens of billions of dollars, but I sort of wonder if the state can solve it.
So, and you're going to probably hear me say this as a thread in most of what I say. The federal government doesn't have direct power to do homelessness because it's not a federal issue. We have to have a way to go into a state. Healthcare, by the way, the federal government does not manage healthcare. The Constitution does not talk about healthcare. And therefore, as a result, as you know, what's not in the Constitution is left for the states. So the states run healthcare. The only reason we're in the game on healthcare is because we put a lot of money on the table, and if the state wants to take the money, they got to follow our rules. That's how we do Medicare, that's how we do Medicaid, that's how we do the Affordable Care Act. Homelessness, we don't do housing in LA, Sacramento. We support, but it's up to the state to do housing. We can try to support. So right now I'm the chair of our Interagency Council on Homelessness in the federal government. Veterans Affairs, HHS, HUD, Education, all the different departments. We're working with the cities, the counties, and the states. We supplement. So HUD supplements through voucher programs and so forth, public housing programs, but we don't do housing directly. We supplement, and we only go in because the states let us come in and because they want to take our HUD dollars, for example.
So the fact that California has 171,000 homeless people, and that number varies a lot, is that's California's fault or problem, essentially, you're saying?
Well, when you're in California and it's 95 degrees in June and it's 75 degrees in November, you're going to find more people who are not housed find a place in California. So we have far more homeless folks than other states do, but it is the responsibility of the state and the local governments to try to address the housing needs of its populations. And so we're working, the federal government is working. For example, we're right now working with cities to try to see how we can make our federal dollars more flexible so that if it's a healthcare dollar, for example, under Medicaid, we're trying to work with HUD so that a HUD dollar and a Medicaid HHS dollar can combine $2 and the city and the state have more flexibility in how they use those $2 the way they think best helps them keep someone housed and keeps them healthy.
Yeah. Of course, a big part of homelessness is mental illness. I think at least a third of folks who are living on the streets have addiction problems or mental health problems of other kinds. That is a health problem. And so what are you doing about that? What would you like to do that you can't do because your hands are tied?
We are doing we're trying to get the states to move towards fulfilling what is national law, which says you're supposed to treat mental health the same as you treat physical health. Very few insurance providers do that. Very few states do that, and what we're trying to do is elevate it. This president has put more money into behavioral health, which includes mental health and also substance use addiction, than any president before. It's still not enough. But for example, I hope you've heard of 988. 988 is the new suicide and crisis lifeline. It's no longer a 10-digit number, depending on what part of the region of the country you're in. All you do now is dial 988. We're hoping 988 becomes what 911 is for emergencies. And so we helped establish that. To give you an idea what it takes, the year before President Biden took office, the program to establish 988 as a national or nationwide number was about $22 million. In the president's 3+ years, he's put in over $1.2 billion into 988 to stand it up, because too many states don't have or don't put in capacity to make that call center work. And so you can call 988, but if nobody answers or they put you on hold, you're not going to call again. We wanted to make sure that if folks did try to reach us, they'd get answered. And so in less than 2 years since we launched in July of 2022, more than 9 million contacts have been made on 988.
I think under ACA, the Affordable Care Act, Obamacare, like you said, there is supposed to be parity for mental health, physical health, but there clearly isn't. The data show that pretty clearly. Why aren't the insurance companies held accountable?
You know, it's lax regulation.
Who sets the regulations?
Mostly the states, because again, healthcare is governed by the states. But if it's Medicare or Medicaid related, then the federal government can as well. And Congress has to give us the tools or the authority so we can go in and be more aggressive in the oversight of what the insurers do. And we're getting closer there, but long ways to go. Remember, it wasn't, maybe 20, 30 years ago, the stigma of mental health services was so great that many avoided going. I remember when I was AG and I would talk to a lot of law enforcement officers, and I'd ask them, what more can we help you do? As I talked to the legislature here about new bills and so forth, they'd say, you know what, it'd be great if I could actually access a therapist or get mental health services and not feel like it's going to damage my chance to have a promotional opportunity in the future. And so here you have a whole bunch of men and women who are in uniform who are afraid to access mental health services because they're afraid it'll deprive them of a chance to be able to move up the ranks.
So the Affordable Care Act then, although it calls for parity, it really can't enforce, the federal government can't enforce that.
We don't have the tools at the Department of Health and Human Services to really enforce the way it should be. So to give you a quick example, we have an Office for Civil Rights. If you're deprived access to the health care you need, mental health services, for example, if you report that to us, we can investigate it. The Office of Civil Rights hasn't had a budget increase in more than a decade. And the number of complaints it has received have grown dramatically, because now you have not just Medicaid and Medicare, but now you have the Affordable Care Act. And now you have all the attacks that people are facing because they're LGBTQI+, or they are women seeking reproductive services. And so we don't have the capacity to do what we should if Congress were to give us the resources to do it right. By the way, the states have more authorities than we do to regulate those things, but the federal government has authorities as well.
Well, speaking of Congress, yesterday Republicans in the Senate blocked a bill that Democrats were pushing to codify access, the right to access for contraception, things like IUDs, Plan B. A lot of people saw that as kind of an election year stunt to kind of get Republicans on the record. But I'm wondering, how at risk really are women, say, in a state like California or New York? I realize it's a big problem nationally, but I guess a lot of people feel that we're insulated here because of the laws we have and the rights that are here and recognized. But how do you see it as Secretary?
We certainly have a better chance of getting the care we need in California. But even in California, you can go into communities where providers will question what they can and cannot do. And that, time could be the difference between a good outcome and a bad outcome. And so it is not a good thing to have a disequilibrium when it comes to healthcare and access rights. And so great that California is forward-leaning when it comes to access to care, especially on reproductive rights. It doesn't guarantee that a woman receives all the care she needs. And certainly in these states that restrict access to care, the stories abound of how women had to wait till they really were in a life or death situation before they could get care. And it doesn't even have to deal with abortion. I was in Alabama where women were telling me they were going through IVF, in vitro fertilization, where midway through the process, it was halted because of the Supreme Court, the Alabama Supreme Court decision that said that an egg, a fertilized egg, was essentially a life, and if it was destroyed, that could be acted upon as a killing. And so all of a sudden, all these centers that did IVF said, we have to stop. And so here you have women who were midstream, by the way, paying tens of thousands of dollars and didn't know what they could do. So Dobbs impacted more than just abortion care. It impacted access to health care, period.
Governor Newsom and the legislature, Democrats, but some Republicans are mostly Democrats, actually, now that I think of it, but trying to make California a sort of sanctuary for women who can't get the care they need in states like Arizona. And one of the things the governor has talked about is allowing physicians or practitioners who are licensed in Arizona to become licensed here easily and perform whatever needs to be done. Do you have any concerns or questions about that from a federal perspective?
Accessing care should be available to everyone. By the way, I'm not a big fan of the word sanctuary because it makes it sound like you're doing something special when it should be something basic, that you're accessing health care rights. If you're an immigrant, you shouldn't have to go to a sanctuary to not fear for your life. And so I think it's unfortunate that we have to take this approach where we have to provide sanctuary to individuals in this country when you're talking about doing humanity's basic work. And so I think it's unfortunate that we talk about it that way. But again, to the issue of whether California should be accessible to provide services, absolutely. And we'll do everything we can to make sure a woman has a chance to access the care she needs wherever it is. But she should have the opportunity to access that care.
Yeah. As you all know, we've had a crisis at the border. A lot of children are coming to this country unaccompanied with adults or by adults. And there have been concerns and reports and warnings about kids being trafficked, kids being abused and neglected. And there were allegations that your office, your department, agency, HHS, and the Department of Labor didn't take those warnings seriously enough, and that these kids were, not looked after properly. What's your response to that?
Emphatically false. Any child that's in our custody is receiving care. We don't cage kids.
But what about once they're, they have a sponsor in this country and they've been handed off, the sponsor's been vetted supposedly, and then they're, with somebody who actually maybe they shouldn't be with.
Right. So there is no doubt that there are young migrants who are being exploited for their labor. By the way, that didn't happen just as a result of this phenomenon at the border in the last few years. I can tell you as a son of immigrants, that's been going on since I've been alive. And before, that migrants, especially young migrants, are taken advantage of. But to your point on this, absolutely there are young people who should not be working who are being exploited. I defy any one of you to name one employer who's been prosecuted for violating the law, their child labor laws. I defy you to name me one company that has been prosecuted for violating the law. Congress is making a big deal of the fact that migrants, and especially young migrants, are being exploited for their labor. And it's true they are. But I have no jurisdiction. Once a child is put into the custody of a sponsor, Congress took away any jurisdiction I have over that child. I have jurisdiction over that child only while they are in my custody and I'm caring for them. And so they make this big deal about how kids are being trafficked or kids are becoming lost. I have not seen one of those members of Congress submit legislation that gives me authority to actually go find out what's going on with that child, because I don't have authority and I can't use money unless I have authority to do any of that stuff. I've said it over and over to them. We've known about the exploitation for the longest time. It didn't take this cohort of migrants to tell us that migrants have been exploited for generations.
Should the Department of Justice, I mean, you say no one's been sued, so who?
Department of Justice really doesn't have jurisdiction either, because these are individuals who are waiting for their asylum hearings to take place. And so while they're out in the community, they are essentially detached from the federal government until they have their hearing.
But what about their employer?
Absolutely. Well, the employer is liable because they're violating U.S. law, not because they're doing anything to that migrant in particular. They're just violating U.S. law if they're employing kids. And we absolutely could take action against them. But if these politicians were serious, that they were so concerned about these kids, then they'd be going after the folks that are actually exploiting these children and violating the law. I don't mind. Give me jurisdiction to follow the child after we place them with a sponsor. Just give me some money to do it as well. So far, Congress has not decided to give me authority or money to actually follow these kids.
Here's an awkward pivot, cannabis. You were given, got to talk about it. It's a big issue in California. The president's been talking about it. I think a couple years ago, he asked you to look into rescheduling it from a Schedule I drug, or recommending to the DEA that they do that. Schedule I is the same as heroin and LSD. What is the status of that now?
We did our job. We recommended rescheduling to Schedule III. DEA, Drug Enforcement Agency, now has the final call to make that happen. Department of Justice, DEA is part of DOJ.
Is there resistance in DEA, or?
Talk to DEA. We did our job.
I'm going to take that as a yes.
We did our job, and our scientists reviewed the evidence. We base our actions, FDA bases its actions on the science and the evidence before us. We took action. We took action.
Do you have any concerns as the father of 3 daughters, 3 children, about use of marijuana?
I have concerns when they get out and drive a car, or they go out at night and they're over 21. I have lots of concerns. Thank God they've got great heads on their shoulders. And on something like cannabis, I think they would continue to have great heads on their shoulders. Look, if my daughters could go out and buy a pint of whiskey or a menthol cigarette, we know what we're up against, and let's be real. It's you can't incarcerate your way to a solution here. You can't regulate it, and if you regulate it the right way, which we're supposed to do for alcohol and cigarettes and all the rest, then we can manage it. But we have to make a decision. California and more than half of the states have made a decision that they'd rather regulate this than criminalize it. The U.S. FDA, the scientists have spoken and said we should deschedule from Schedule I to Schedule III on cannabis. Let's move forward.
You were confirmed as HHS Secretary, I think, in March of 2021. The vote was 50 to 49.
Yes, it was.
That was the closest, I think, of anyone who got confirmed. And you didn't have health background, a healthcare, in sort of a traditional way. What sort of impediment did that? What was your learning curve like?
Well, for the 24 years I was in Congress, I did a lot of work on the Ways and Means Committee, especially. I served on the Health Subcommittee and did a ton of work there. As AG, a good number of the cases that I took on against the Trump administration were health-related. In fact, the Affordable Care Act, which I helped draft and helped pass, I'm the one that took it to the Supreme Court to defend it, and we won, obviously. And now, as Secretary, we're implementing, and we're breaking records in the number of people who are actually enrolling on the ACA for insurance coverage. So I've had a chance to see that full circle. Let's put it this way. When you are the CEO of a company, you don't need to have a degree that every one of your personnel have. And I got 90,000 people, so we got lots of degrees. What I have to do is know how to manage a huge operation. We would be, if we were a standalone country, I think we'd be like the 9th economic power in the world, just the Department of Health and Human Services. Our budget, as I said, is about $1.8 trillion.
You inherited an agency that had gone through the beginning of the COVID pandemic with a president who did fast track the vaccine, but who also gave very mixed messages about getting vaccinated, about bleach and all kinds of other things. When you walked in the door, did you find people with PTSD? I mean, like, what did you find in terms of the staff, and you know, how hard was it to sort of turn the ship?
They were hungry to do health and human services, and they are fabulous folks. Very dedicated group of folks, really on top of their game. I don't want to say more because the private sector will steal too many of them, but we have some of the brightest people. They are stellar. It is not easy to come out of a pandemic. It is not easy to convince the public to believe in a vaccine, especially when you got others who are saying crazy things like what you've mentioned. It's a really good core group of folks who do this work at HHS. So I think they just enjoyed that they got to really launch and do the things they thought they were going to do when they signed up.
The rate of vaccination for booster shots is going down, even among people who are very vulnerable, seniors, for example. Why?
I do think a lot of it is the misinformation that's out there. No one is, implanting chips in your body when they inject you with a vaccine. We're seeing things like malaria, tuberculosis resurface in the country after we had essentially eradicated those diseases. Children are less and less likely to be vaccinated today than they were 10 years ago. It's tough. We don't have a budget to do marketing the way pharmaceutical companies have, and it's tough. And we rely on trusted voices. We go and ask the teacher or the athletic coach or the barber or the clergy.
You had Travis Kelce, where's Taylor Swift?
You got a phone number?
I don't.
But, it is tough. And, the only time folks react is when they see their relatives dying. And that's not the best time to react. So we're going to continue to get out there and try to provide correct information. Hope we can get, through the fog of the disinformation, because there are some deadly viruses out there that could hit us. Avian flu, right now, we're hanging in there, but the longer that virus hangs around and gets to continue to mutate as it's infecting now cows, at some point it's going to jump.
We're in the middle, of course, of a presidential campaign, you might have heard. The Heritage Foundation came out with I think it was 800 or 900 pages of something called Project 2024, which is kind of a blueprint for Donald Trump if he gets back into the White House. What concerns you the most as former Attorney General, as the current HHS Secretary, about what could be undone or done by somebody coming in who doesn't have all the guardrails necessarily that would keep things on track?
Science and the rule of law.
And how does that play out?
Not well. Not well. I mean, the Food and Drug Administration, sometimes it gets bashed for what it does because it doesn't act quick enough to get a drug out there to the market that could save lives. Or it put out a drug that didn't work. But the FDA, I just came back from Geneva where the World Health Assembly was meeting in 194 countries. We were talking about pandemic preparedness and all the rest. FDA is the gold standard around the world. And they do some pretty good stuff. Their standard is safe and effective. If you produce a product that's safe and effective, then the consumers get access to it. But if you can't prove with science and facts that it's safe and effective, then we don't give you license to put that out in market. Other countries don't have an FDA, and that's where you hear the stories of the lead contamination in the toys or in the food products that you give your infants. It is tough to do things right. But that's all based on science and a regime, a rule of law, a rules of the road. We do a pretty good job of adhering to science and following the rules of the road. I fear we will abandon that if we're not careful.
Yeah. We have to wrap, but before we go, it would be journalistic malpractice for me not to ask you if you, without violating the Hatch Act, are thinking of running for governor. Would you like to be governor of California? That doesn't work on the radio, by the way. Silence.
I see we ran out of time.
Well, take all the time you need.
You know what? It is a wonderful question to get to contemplate. And I say that, and I mean that seriously, because I'm the first in my family to get a chance to get a college degree, a bachelor's degree. I never thought I would be an elected office. I never thought I would be attorney general. I never thought I would be a secretary of the cabinet of a president. Neither did my parents, by the way. Not because they didn't think I was smart. It just, they were afraid. My dad worked in construction a good portion of his life, road construction, heyday of the freeways, Highway 5 and all these things. I started working in construction as well as a laborer. And my parents didn't tell me till afterwards, after I graduated from Stanford. They said, we were afraid to tell you this, but when we saw you start working as a road construction worker alongside your dad, we were afraid you would be so enticed by the big money you make as a laborer that you would not go back to school and finish college. Because that was pretty big money for my parents, to have a union wage, a steady job. And so did they expect that I'd get to be a secretary in a cabinet? No. So to ask the question, would I like to run for governor and contemplate it? It's a great question to get to contemplate, because very few people probably looked at me when I was a kid and said, he's going to get to contemplate whether he wants to be governor. So here's my answer. I am a Secretary of Health and Human Services. I will stay Secretary of the Department of Health and Human Services.
How long?
And I can't contemplate something other than being Secretary of Health and Human Services until I leave the position. So it's nice to get to contemplate.
All right. Well, I tried to make some news. Thank you so much. Appreciate it.